Thank you for joining us for our zip codes and breast cancer, working together for healthier places. My name is Catherine Thompson. I'm a program director at Zero Breast Cancer. And we also have with us Leanna Hartmore, our other program director, and she is running the show behind the scenes. So she will be helping to make sure things are running smoothly, and we couldn't do it without her, obviously. So before we get started, I want to acknowledge that I am on unceded Muwekma Ohlone lands and that our ZBC offices are on coastal Miwok lands. This is the second in our series, Advancing Health Equity in Breast Cancer. And what we want to do first is, of course, tell you or make sure that we all understand what health equity is. Given so many people are in public health, I imagine we have a pretty good idea, but I personally really like the NIH definition, and that is health equity is when everyone has the opportunity to attain full health potential and no one is disadvantaged from achieving this potential because of social position or any other socially defined circumstance. And I want to make sure that as we're talking today, that we know that health is not just the absence of disease. Our physical health is directly impacted by our mental and emotional state, our social, economic, and spiritual well-being. And when we talk about advancing health equity, we mean addressing systemic disparities between more and less advantaged groups across our population. Before I introduce our speakers, let me tell you a little bit about Zero Breast Cancer. For 25 years, we have been working to reduce the risk of breast cancer and of disease recurrence, and also to improve the quality of life for those who are living with cancer. We collaborate with affected communities and with scientists to create campaigns to help individuals and communities improve health and wellness, always in at least English and Spanish, and sometimes in other languages. Our content is freely available online and accessed around the world, especially in Latin America. We've been getting a lot of hits on our videos. And it's also distributed through schools and through organizations that serve lower income clients in California and across the US, including US territories. On our website, you can find campaigns for people of all ages with and without breast cancer. And on this slide, you can see some of the people from the communities who have been involved in our work. For everyone who's on social media, please use the ZBC Bridge hashtag to share what you're learning and tag us during this webinar. You will also find these links in the chat box, so be watching there as we're going along for more information, links, etc. Our panel members today are going to talk about how place matters for breast cancer risk and outcomes, and how we can work together for healthier communities. So it takes a lot of resources to make and keep our communities healthy. This is a list just of some of the things that we have identified as being necessary. Now, the list here on the left, the access ones, some of those are very concrete and tangible things, like safe parks nearby and access to healthy and affordable food. But we also need things that are harder to point to and sometimes to build. And those are things like social support. We can have places to gather, but how do we engage the community? So how do we build good policies? So we'll be showing this slide again later, and you'll also be receiving a copy of the slides. So don't worry if you are wanting to note anything down. All right, now it is my great pleasure to introduce three inspiring women. You can read their full biographies on our website. Well, they're not even full, those are even just short ones. But there are links there that will take you to their websites where they can have more information. First, today we're going to be hearing from Dr. Scarlett Gomez. She is our featured researcher. And Scarlett is affiliated with the University of California, San Francisco, both the epidemiology department and the Helen Diller Family Comprehensive Cancer Center. Her work focuses on social determinants of health. That's what we're here to talk about today. So the things that she focuses on include race and ethnicity, socioeconomic status, gender, immigration and immigration status, sociocultural factors, and neighborhood characteristics. She has collaborated with Zero Breast Cancer for many years now on the Pathways Breast Cancer Survivorship Study. So welcome, Scarlett. She will be followed by two advocates from organizations that are making a real difference in their communities. Diane Velez leads the CalFresh Healthy Communities programs for active SGV, and SGV stands for San Gabriel Valley, which is in Southern California, and I know it well. She started with the organization as a volunteer 5 years ago, and since then she has been working on safe routes to school, as well as empowering women and girls through biking. She is passionate about improving the health and sustainability in her community. So welcome, Diane. And Lesley Kailani brought her passion for advocacy with marginalized communities from therapeutic art to metastatic breast cancer after she was diagnosed in 2012. She recently launched Project Life, which is a virtual wellness house for those living with metastatic breast cancer and their loved ones. It's a place for people to learn and share. This project was part of her work as an Elevate ambassador with the National Coalition for Cancer Survivorship, an excellent organization. For her community with this aggressive form of breast cancer. So welcome, Lesley. After our speakers, we'll have at least 15 minutes for questions and discussion. So please write those in the Q&A box as we go along, so you don't forget your questions for each speaker, since we won't be stopping between the presentations. So let me just double check in the chat box if there's anything. Oh, great. So it looks like we are good to go. Scarlett, would you please take it away?
I will, thank you. Let me go ahead and pull up my presentation. There we go. How is that? Can you guys see that okay?
Yes.
And my audio is coming through. Okay, great. Thank you, Catherine, for that really nice introduction. And I just have to say, it's such a, I've been over this past very difficult and challenging year, I've been giving a lot of virtual conferences. This is one that I really look forward to, because it's always such a great honor and pleasure to be able to share the work that I and my research group at UCSF are doing, and really to hear from the various stakeholders and community members about how we can really focus and translate our research. So I'm going to be talking about neighborhoods, obviously in breast cancer, and really focusing on the role of data and research to achieve health equity, since that really is a key theme of the series of webinars. And to sort of set the stage, I want to just kind of draw your attention to the backdrop, the aerial view that you see here, and hopefully most of you recognize what this aerial view is. It's of San Francisco. You see the Bay Bridge in the back and Treasure Island here. And in particular, this area here that you see on the bottom right is called the Mission Bay area of San Francisco. It's one of the most rapidly developing urban areas in San Francisco. It's also the home to a lot of tech companies and the Mission Bay UCSF campus. This picture was taken, I think, about 5 or 6 years ago. And in fact, I was just there on campus after not having been there in over a year. I was there a couple of weeks ago, and it already looks very different from here. This parking lot here is now a large neurosciences building. This empty space that you see here that I'm pointing at is now the new Warriors Stadium, as well as home to other tech companies. And what I wanted to point out with this map is that if you drive down this street here is 3rd Street. If you just drive down 3rd Street for another mile, you hit the Bayview Hunters Point area, which is a very, very different demographic of people who live there and the businesses that are there compared to what we see here in Mission Bay. It's just a mile away and it's like you're in a different world. It's also home to shipyards, and so there's a lot of known historical pollution in the area. And so that is really just to point out that racial residential segregation is alive and well to this day, and that's really going to be a theme to what I'm going to be sharing with you. And so with that in mind, I just really like this quote from Dr. David Williams, who is really considered a key father of social epidemiology for those of us who do research in social epidemiology. This quote from Dr. Williams came from the PBS documentary from now a few years ago, but certainly still relevant to this day. The documentary is called Unnatural Causes, and it was a 4-part series. He was featured in one of the series called Place Matters. I know Liana is putting the URL to access this documentary. It is, I believe, still free for streaming. So if you're not familiar with it or haven't seen it, I'd really highly encourage you to take a look. So what Dr. Williams said is, when we think about health, we usually think about healthcare and access to healthcare and the quality of that care. But what research clearly shows is that health is embedded in the larger conditions in which we live and work. So what does this mean in terms of how we help people to improve their health? Well, we naively think of improving health by simply getting people to change their behaviors, but recognizing the importance of context, the choices of individuals are often limited by the environments in which they live. So our research group really focuses on studying the social aspects, social environmental characteristics, and these include things like the socioeconomic status of the neighborhood, levels of crime, levels of gentrification, and how that neighborhood has changed over time or displaced to certain populations over time, ethnic enclaves such as Chinatown, Little Italy, segregation, as we talked about at the beginning, the composition racial ethnically of the neighborhood, and the degree of social capital or social cohesion. That is the idea of neighbors coming together towards a common need. We're also really interested in looking at the built environment. This is defined as aspects of our neighborhoods that are affected, that are influenced or built by man or mankind. These include things like population density, how many people live in the neighborhood, housing characteristics, commuting patterns of people who live in your neighborhood. Is there access to parks and green spaces, recreational facilities for people to engage in physical exercise? The food environment, which we'll talk about in a little bit, street connectivity, which is a term that defines how streets are connected. Are we talking about a very grid-like kind of pattern, which is known to be more walkable, or are we talking about having lots of cul-de-sacs, for example? And of course, traffic density. Just to give you an example about how the built environment may influence or provide, shape health behaviors of people living in a neighborhood. Sorry about that. My dogs are obviously excited about what I have to say. There are actually a number of studies, and then this is growing, showing that the food environment is related to weight and obesity. And so these studies have shown that having more convenience stores, more fast food restaurants, and how close and directly accessible those convenience stores and restaurants are actually related to higher levels of weight and more residents being more likely to be obese. Also, living in a food desert, which we define as a neighborhood or an area that has limited access to affordable and nutritious foods, is associated with being more likely to be overweight and obese. And these are studies that have been done not only in adults, but in children as well. So it's the neighborhood environments that we live in are incredibly formative for the development and establishing healthy lifestyles among children as they age into adults. Just to kind of provide a little vignette here, there is a CNN documentary, again, another fabulous documentary if you have a chance to view it, called Being Black in America. In that documentary, there is a story of a woman who lives in East Harlem, and the narrator asked her, well, how are you able to buy a fresh tomato? So she talks about what it would take for her to purchase a fresh tomato. She basically would have to get on 2 buses, go across town, get the fresh tomato, 2 buses back. It's a 4-hour round trip. And so, of course, because she works 2 jobs, she doesn't have that time to be able to buy that fresh tomato. And I thought that was such a powerful vignette to really illustrate the importance of the food environment that we live in. Just another little story is pre-pandemic, I was in Nashville giving a talk at Meharry University. And I was talking about the built environment. And afterwards, a resident came up to me, a local advocate, and said, that just really resonated with me, what you said, because I've actually noticed that in my grocery store in my neighborhood, the bananas are always rotten and brown. But if I cross the train tracks, go to the same exact chain grocery store on the other side of the train tracks, those bananas are beautiful and yellow and not rotten and brown. So even within the same grocery chain, there's targeting of the quality of the food to particular neighborhoods. And the access to foods, healthy foods within neighborhoods is shaped by levels of segregation, and we know varies by socioeconomic status. Just as a quick example, comparing 2 neighboring neighborhoods, East LA and West LA. East LA, we have almost 6,000 people per grocery store, whereas in West LA, 3,700 people per grocery store. In East LA, 72% of restaurants are fast food compared to 41% of restaurants in West LA. And so further on segregation and the importance of segregation, and really thinking of it as an upstream factor that influences the built environment. This was another study that we did where we looked at data among women with breast cancer. Specifically, we looked at Black women with breast cancer and white women with breast cancer. And the reason this was interesting to us is because we know that Black women, once diagnosed with breast cancer, have worse survival compared to white women. And so we asked the question, how much is this related to the level of segregation in the neighborhoods that Black women live in versus white women? And what we found was that in levels with moderate and high levels of segregation, neighborhoods with more Black residents translated to better survival among Black women with breast cancer, whereas we saw worse survival among white women with breast cancer. So that is to say, Black women who live in cities that have lots of segregation, if their immediate neighborhood also has a lot of Black residents, that was actually a protective effect in terms of their survival experience. And so this led us to wonder whether there might be something related to how much social support and the degree of social networks that Black women are forming from within community members of the same race ethnicity. And I think potentially illustrates for us the power of human resources to collectively overcome otherwise adverse living conditions. And I think this could be informative and telling for us in terms of how we might design interventions to counteract adverse living conditions, such as those due to segregation. And so just as a brief summary, this is a relatively nascent field in that we are starting to accumulate knowledge on the role of neighborhoods and breast cancer, but there's still a lot we don't know. This is just a very high level grid that summarizes what we know with regards to different types of neighborhood characteristics, such as neighborhood socioeconomic status, ethnic enclaves or density, ethnic composition specific to Black populations, segregation, structural racism, rurality, and built environment, and how each of these, what the literature is currently showing with regards to their associations with risk factors, breast cancer risk factors, breast cancer incidence, stage, quality of life, and survival. And so just to walk you through one of these, neighborhood socioeconomic status actually shows a mixed levels of association with different risk factors, depending on the risk factors that you're talking about, and maybe even what stage of life you're talking about. Higher socioeconomic status, we know, is related to higher breast cancer incidence, but it's inversely associated with stage. So women with higher socioeconomic status are more likely to be diagnosed with earlier stage, and they're also more likely to have better quality of life and better survival over time. So we're really trying to understand these patterns better within the pathway study. Catherine mentioned our collaboration at UCSF with Kaiser investigators at Kaiser Permanente and Roswell Park in Buffalo, New York, with zero breast cancer over the past 10 years on the pathway study. Here are different ways that we're pulling in data to characterize neighborhoods within the pathway study. We're linking to existing geospatial data. We're asking women to self-report on their neighborhoods, and we're conducting virtual street audits using Google Street View. Just briefly, in terms of future directions of research, where we in this community feel that this area really should be headed into is to really promote multi-level research. It really should be not just the research that we're doing in social epidemiology, but really we really should be caring and looking at neighborhood factors and upstream structural factors really in all research because of its relevance in all research, and really trying to understand which particular neighborhood types and attributes are related to higher or lower risk of breast cancer and for which population groups. And I think it's important to start to understand what are the biological mechanisms by which neighborhoods impact health. Is it through health behaviors? Is it through stress? Is it through healthcare access? Is it through some other pathway? And as we illustrated in the study of segregation, there may be resiliency factors that are built among communities over time. And it's important to identify what those are so that we may translate those into other at-risk communities. And absolutely, it's important to understand how different social determinants intersect with each other, but also how personal factors intersect with contextual or neighborhood level factors. And lastly, I just want to point you to two web portals tools that our group has developed. And I know Leanna will put those in the chats as well. One is called Californiahealthmaps Org. And what this does is that anyone can go on here and you can basically map cancer rates for particular neighborhoods alongside different health behavior and socio-demographic factors. So really encourage you to take a look and let us know what you think. And then the second tool is called Health Atlas. This was built by colleagues as well as our group at UCSF, and it provides maps of over 100 variables to explore at the neighborhood level and then see how they may relate to different health outcomes. And so I just want to end on this cartoon, which we'll bring up later on, and really with the goal to emphasize the role and the importance of upstream factors being social inequities and institutional inequities. We're talking about place matters, we're talking about living conditions, but these are really shaped by these upstream factors. So unless we want to, so in order to create equity in living conditions and place, we really need to be addressing the upstream factors. Thank you.
Hey, Scarlett. Diane.
Great. Thank you so much for that, Dr. Lin Gomez. Hi, everyone. My name is Diane Velez. I am a Healthy Communities Director out of active San Gabriel Valley. If you're not familiar with the SGV or San Gabriel Valley, it is located east of East Los Angeles. So if you know where downtown Los Angeles is, we're about 20 minutes away from that, heading east. And we could switch the slide. Thank you. So our mission is to support a more sustainable, equitable, and livable San Gabriel Valley. If you're not familiar with the SGV, it is a place that houses a lot of Latinx and Asian immigrants to the community, right? We have a large population of folks that English is not their first language. We have a lot of folks that deal with many other factors and risk factors that Dr. Lin Gomez expressed in the previous slides. And our mission is to provide a place that is better for our community. We could switch the slide. And we could continue switching the slide as I continue on this. So one of the ways in which we do this is we partner with different businesses across the San Gabriel Valley to encourage them to create a really kind of a network of businesses that provide incentives for folks to do more walking, more biking in their community. And we know that this is not easy, right? You can have a store that supports this type of behavior, but one, if they don't provide a discount, two, if they don't provide bike parking, if they don't provide safety, but also because of the city infrastructure and the built environment, the way that that's set up, not all communities are great for people to walk and bike and be able to be active in their community. So what we did is we targeted certain communities across the SGV that we know have a hard time of getting folks to walk and bike and provide incentives for those stores, such as discounts, such as putting their information up on social media, and giving them little awards to the stores that were partnering with this. And we were able to get folks to come out. And this is a project that we've been running for the past 3 years that's been very successful. And we've noticed a slight change in behavior within communities. And we can continue with the slides. It's just pictures of what it looks like. We host monthly rides to different stores. Of course, because of COVID, we had to stop doing this, but we like to support small businesses only on these rides. We can continue. All right, so this is our Bicycle Education Center, and we opened this a few years back. We did this because we noticed that there was a big need for folks in transportation. So we initially started as a Facebook group that provided just information about how to get around on your bike, because people were really interested in knowing, how can I get around on a bike instead of driving 2-3 miles around? Then we noticed that there was a big need for transportation in general that wasn't regarding a car or a vehicle. We noticed that people needed bicycles. So we started the Bicycle Education Center, and we can continue with the next slide. And the way that it works is, imagine a cooperative where folks of all ages can come in. We have different bike parts that have been donated by different entities, and you can build your own bike from scratch. Or if you already have your own bike, you can come and ask questions and learn how to fix it up. And we have a program where you build a bike, give a bike. So for example, these students came in, they built a bike, and we were able to donate a bike to someone in need in their school, right? So really it's about building community and bringing people together to make sure that you're helping each other out. Next slide. And this is where our office is located. So we have a very cool space. It is located in an abandoned or unused school. So as you may know, in the state of California, there is a lot of low enrollment within elementary schools and middle schools. This happens to be one of the schools that had low enrollment, so it was shut down. It was empty for many years, and then it became a hub for nonprofits within the San Gabriel Valley. We just happen to be one of them that has an office there. So along with our friends at Amigos de los Rios, we revamped the entire space. We created a bike park. We created spaces for different nonprofits to come and provide their services. So instead of having to go all around town trying to find a place where you can find your food bank, and another place where you could find your bicycle, and another place where you could do your taxes, you can do all of that in one location. And it is at this school, at the Jeff Seymour Family Center, housed in El Monte. And we could go to the next slide. And this is what it currently looks like right now. And we could go to the next slide. We also built a pump track. So if you're not familiar with the pump track, no worries. We were new to this too. We realized that there was a need for recreation for a lot of youth and a lot of adults, we found out, that do BMX bike riding. And there isn't a space in the San Gabriel Valley to do this. So we decided, well, we have a huge lot. Why don't we build one? And it became an entire community effort of volunteers. And we have an outstanding volunteer. His name is Peter Porras. And he goes out there every Saturday to help build these little bumps for the bicycles to ride these. So we could go to the next slide. And our Women on Wheels program. So this one I want to highlight. I am part of the Women on Wheels project. And this started out of the need for women to be able to feel safe while riding their bicycle in the San Gabriel Valley. We noticed, at least for me, that I didn't feel safe riding my bike in the morning to work, even though I only lived about 5 miles away from the office. I was scared, I was nervous, it was intimidating. And then we realized that a couple of us lived on the same route. So we just started kind of having a bike train in the mornings. And it grew out of that. It grew out of the necessity to feel safer within community and with other women. And Women on Wheels tries to provide services from young girls all the way up until adulthood, right? So we have rides where women can come and join us, bring their daughters, bring their sons on the rides too. We teach courses on how to change your own flat tire in case you find yourself needing to do that on your own. And it really is about encouraging safety and visibility. One of the measures of safety within a community, within a city, is noticing how many women and how many girls walk on the street by themselves, right? If you don't see that often, that's kind of a significant factor to know, is this a safe neighborhood or not? Does someone feel safe doing that? And in a lot of the communities in the SGB, we don't see that. We don't see it often. So we could go to the next slide. And that's us in one of the girls' events. Next slide. All right, and another way that we create community is by open streets events. So you may be familiar in your neighborhood, they may have hosted these in the past. These are called ciclovías. They started out in Bogota, Colombia, back in the 70s. And the idea really grew, and it's about closing down streets to car traffic and opening it up to people power, right? So you can walk, you can be a pedestrian, walk your dog, ride your bike, anything that doesn't have a motor. And one of the ways that this has helped is one, creating community again, but two, really being able to provide a resource and an outlet for communities such as the San Gabriel Valley that oftentimes don't have green spaces. And while yes, we have the mountains very close, accessibility is a huge factor for our communities, right? Not everyone has a vehicle, not everyone can drive up the mountain. We do live fairly close, within about 30 minutes from the beach, but a lot of our community has never even seen the ocean. And that is one of other projects that we also have Active SGB, is getting folks to go out to understand how water system works. And really the Ciclovia events have connected all of that for us. And we could go to the next slide. And this is just a flyer. We had an 18.5 miles of open streets. It was a huge success, but also a huge treat for us. So much work, and with the Gold Line extension, that is our local train metro system, we connected with them to be able to move folks back and forth. Go to the next slide. And this is just a sample of another Open Streets event that we hosted. We could go to the next slide. All right. And lastly, I just wanted to go over the importance of community, the built environment, the spaces that we live in. We know that we cannot easily change where we live or maybe where we grow up. However, there are changes that you can make within your community, right? We started off as a Facebook group. You could start off by joining the local zero waste group or the local Buy Nothing group within your community. Asking questions, seeing how you can improve the built environment slowly within community, within your own neighborhood. And I'll stick around for questions in the Q&A. Thank you so much for your time.
Hello, everyone. My name is Lesley Glenn. And while I'm not in California, like the rest of my speakers, I am actually based out of Southern Oregon. And I am here to talk today about my new initiative called Project Life. And really what it was based out of the health inequity for those that are living with advanced cancers. When I was diagnosed in 2012 with breast cancer, and then 6 months later diagnosed with incurable metastatic breast cancer, what I noticed is that there were not any survivorship programs out there for those of us that were living with this incurable diagnosis. At that time, I didn't really think anything about it until this past 2 years, where I began to notice that there were a lot of people that were missing out of just being able to live well with stage 4 metastatic breast cancer. And so through my partnership with the NCCS, I brought together this model of a virtual wellness house to meet the needs for those that have been diagnosed with metastatic breast cancer, and also including their loved ones. So next slide. So as breast cancer research has moved forward, we are living longer. Still, the statistics is that 116 still pass away every single day, but there are those treatments that are coming out that are actually helping people like myself. I'm going on 9 years of living with metastatic breast cancer, and that is because of the treatments and the research and the funding going in to helping us to live a better quality of life and to add some months and years onto the outcomes. Dr. Julie Graylow, who is one of the biggest advocates out there for the breast cancer community, she said, metastatic breast cancer patients are living longer than ever, but only if they have access to diagnostics, drugs, supportive care, and clinical trials. And so Project Life was formed to address the supportive care for the metastatic breast cancer community. I will say that the metastatic breast cancer community, the advocates, we're a noisy group, which means that we become squeaky wheels until finally someone says, all right, we're tired of listening to you guys. We're going to make something happen. And if that's what it takes, that is what we're going to continue to do. Next slide. So again, Project Life is a virtual wellness house offering programming and support to those living with metastatic breast cancer, their caregivers, and also their children through our 5 dimensions of wellness. I will say that we also promote collaborations with cancer centers and organizations that resource the MBC community throughout the entire US. And we even have started a project in Kenya. Next slide. So these are our 5 dimensions of wellness: social, emotional, physical, financial, and spiritual. And I really appreciated the graphic that Dr. Lin Gomez shared about the upstream and the downstream, because I can see where Project Life might not fit exactly into the upstream. We're definitely down there in the downstream of helping people that are living with stage 4 disease through health outcomes, through what they're going through socially, having the support systems, emotionally dealing with an incurable diagnosis, physical limitations, financial toxicity, and then, spiritual, not in a religious type of way, but being mindful and being present as they live out their life. Next slide. So we have 3 buckets of focus. The first one is our online platform, which is our wellness house. And our wellness house, we'll get to that in another slide, is set up to be all encompassing for those that are living with MBC. We also are a pass-through resource hub. We realize that there are those that live in certain zip codes that do not get the resources that they need. And so we are answering that through our online platform. But we also know that there are people in certain zip codes that do have the resources. They just do not know about them. And so Project Life will use this to pass people through to community organizations in their own neighborhoods where they're living in their cities, so that they can be able to get the resources, such as what Diane's group is doing. Somebody came through and said, hey, do you know anything that's going on in Southern California regarding, getting out and getting some exercise with my bike? We would definitely want to pass them right through to what Diane and her group is doing in the San Gabriel Valley. And then we also pride ourselves with partnerships and collaborations. So we don't profess to know it all. We do not want to be all things for all people. But so we're looking for partnerships and collaborations to work together. A good example would be, we now work with Dana-Farber, and we work with Johns Hopkins, and they send us some of their metastatic breast cancer patients, and we in turn will send back those metastatic breast cancer patients that might not know about the resources that these large hospitals have. And so we can help to partnership and collaborate with that. Next slide, please. So our virtual wellness house is set up just like a house. We have a foyer for our newly diagnosed and learning self-advocacy. We have our living room where we have couch conversations. We have our art studio where we do therapeutic art classes, our library, where we host a book club, and everything has to do with living with a cancer diagnosis. It's also going to be full of resources. In our garden, you'll find mentoring and mindfulness classes. In our den, we're super excited that we have someone on our team who is a lawyer who also lives with metastatic breast cancer, who will be giving legal clinics twice a month for free. And then the kitchen, we have a house chef, and then the backyard where we will do exercise and a kids camp and some play group type activities for the children of those that are living with metastatic breast cancer. Next slide. So again, we pride ourselves of being a pass-through resource hub and being sure that people, no matter what their geographical region is that we're being able to pass them through if there are resources in their area. Next slide. And then these are some of the partnerships and collaborations that we have in the works right now. And next slide. And then these are my personal networks that I have built through being an advocate for the past 6 years. And so working together with these networks and sharing about Project Life, we're able to really build a community for this health inequity of survivorship programs not being readily available for those of us with end-stage breast cancer. And so we are really looking forward at changing the narrative that we actually fit into the survivorship definition that the NCI put out, which was from the day of diagnosis until the day that you die. And their definition also includes the caregivers, which we feel is very, very important. Next slide. And so what is our big vision? Well, the big vision is to establish Project Life wellness houses across the US for all of those who live with metastatic disease. And we know that this is, a great big undertaking. And we have some really big goals ahead for us, which includes actually going out into the Native American population and finding the best way to partner with the reservations that are in, especially here in the Pacific Northwest, and helping them with the support for living with metastatic breast cancer. And I think that's the end of my slides. So this is my information, and I will be here to answer any questions, but thank you very much for inviting me.
Okay, thank you so much to all of our speakers. If you would all please come back on to video so everybody can see who is in the room. So I'm just bringing this slide back up so that we can remember some of the different elements that are part of a healthy community. There have already been some really good questions in the Q&A, so I encourage folks to please continue to type those in. And to now, we would like to know what it is that you would like to see changed in your community. So what is it that, oops, that went all the way back to the beginning. What is it in your community that you would like to have changed? And there's the poll now, or to have improved. So we'll give you a minute or a few moments. And again, this is a multiple choice, choose all that apply, because there are so many different aspects. want to give folks just a little time. Okay, it looks like we have more Q&As coming in too. Wonderful. So, affordable housing, that is a huge problem across the country. 71%, but over 50% also selected healthy food, safe places to walk, roll, and bike, quality health care, and job opportunities. Obviously, there are many needs out there. Social support got almost 50% as well. So let's go ahead and get the discussion started. Before I start pestering anyone, I just wanted to bring up this slide that Scarlett had shared, the upstream downstream slide, because it is, I think, a really nice way of showing how the different elements that go into a healthy community are mostly outside of our control. A lot of people think about our health behaviors as being within our control, but if you don't live in a place that has healthy foods available, where the parks are far away, there's no safe place to walk, as Diane was saying, especially for women, then there are not a lot of options for those healthy behaviors. And this is really one of the reasons why Zero Breast Cancer is so focused on this area. We want to be able to help to make a change. So as we start our discussion, I just wanted to bring up this slide to help people to think about some of the different things that we as individuals can do to gather with others, to work with other people. And I loved the story, Diane, about the active SGV having started as a Facebook group. I think, that's just amazing that, people found each other and found that common issue that really needed to be addressed in the community. And that brought you together and working together, and then you found the resources. So in the Q&A, somebody was wondering about, what resources were available in their area, and that is not always easy to find. So Scarlett, I know that you did take a shot at that. Or actually any of the three of you, how do you find the resources in your local area?
I'll take a shot at that. I wish that there was one go-to place, and I wish that the healthcare providers or whoever patients are really interacting with are better equipped and armed to be able to provide those resources. And I think we're starting to get there. A lot of healthcare institutions now are really taking this idea of social needs very seriously, assessing social needs among their patients and having resources in place to address the social needs. Do you have housing insecurity? Do you have food insecurity? Here are local resources that I can help you connect you with. And I think having navigators and social workers in place to be able to make those kinds of connections are incredibly helpful. I think in San Francisco, San Francisco General, for example, and UCSF is starting to move in this kind of direction, but I do think that having community health centers and places where patients, again, are actively interacting with, take this on would be incredibly valuable.
Anyone else want to add anything?
Yeah, so I think that is an amazing question. And I know that sometimes I will find out about resources and I'll be like, oh my gosh, where has that been for the past 8 years? And it's always been there. I just didn't know about it. So for me, it has been a lot of networking and a lot of talking with others and seeing where they're getting help. Somebody turned me on to this site. I think it was called Aunt Bertha, but now it's called findhelp.org. And that is an amazing resource where you can put in a zip code and it will come up with a whole list of like food assistance, housing assistance, and so forth. So I hope that helps.
Wonderful, thank you. Yes. And as we're thinking about the different ways that people can try to help to make that change, I do want to mention that there are a couple of resources out there if you are not sure where to start or what it is that you might have the talents to do. Story of Stuff has, let's see, what's it called? What kind of change maker are you? They have a quiz to find out where your talents can best be used. And Leanna is going to put that into the chat. There's also an organization called Roots and Shoots that has great resources for kids to help them to figure out where they might be able to make a difference in their communities. And there are so many opportunities. This is just a few of the organizations that are working on food security issues. And I know that there are many more, but these are ones that specifically have toolkits to help. For example, Voices for Healthy Kids has a toolkit to help people in the community to make sure that the kids have access to water in their schools, to try to get sugary drinks out, and to have have these models for people within the community to try to work with the local like corner stores to make sure that there are more fruits, fresh fruits and vegetables, so that that tomato story that Scarlett mentioned hopefully will not be repeated. There are lots of questions in here. There is something about chemical exposures. We're going to be doing a future one on environmental exposures and environmental justice. So we will get to that later. And somebody said that the CDC website may be a helpful place for data outside of California. We'll put that into the chat. And there are many people who are saying thank you. So we are coming up on the 1 o'clock hour, and I really want to be able to continue this discussion, or 1 o'clock on the West Coast anyway. So I want to continue the discussion. I will make sure that we are keeping things going, but I do want to also make sure that we thank our sponsors for this, including, of course, the organizations of our wonderful speakers today, and that in case folks have to leave, that I let you know that we are going to be having some more webinars. And if you enjoyed this webinar, please consider donating to Zero Breast Cancer to support this series and our free educational campaigns. There will be, or is, a link in the chat box. And we also hope you will join us for the next in our webinar series. This summer, we're going to be talking about the role of culture and language on health equity and breast cancer. And in the fall, we're going to be talking about how our environmental exposures, things like chemicals, impact breast cancer risk and disparities. There have been a couple of questions about that in the Q&A, and I hope that we will be able to answer those in the fall when we do that, because this is a really important aspect of risk that Zero Breast Cancer addresses. Also, make sure that you are signed up for our email list so you can get notices about these and other events that we hold, as well as our latest content. And if you missed our first webinar that was about community engagement and research, please go to our website and you can get a link for the recording and the slides. And that also is in the chat box. That is on our website, as is the link for today's slides. and that will be going out very soon. So lots more questions. Let's go ahead and go back to those. Has any of the panelists, is there something in the Q&A box that you would like to answer live?
I did want to add one of the great resources that is probably accessible in most communities is a librarian. Libraries I know are closed currently, or at least in our community are currently closed, but you can still call and they still have someone in their desk that will be able to connect you to resources in the county. That's one of the easiest way that we've been able to connect in terms of, well, we have this bike ride or we have this event for people that have different abilities, right? So we're going to use Trisha's, or we're going to use a different adaptable bike. We want to know where the location to find people that have different abilities are. So we go to the librarian. The librarian is able to connect us with different resources across the county. And that's one of the, I think, underrated, and a lot of folks don't know that they can still contact that. That's a free resource in the community.
Okay, somebody asked about the links that are in the chat, and I just want to let you know that those will be available on the YouTube page where the recording for today is going to be housed. So yes, you will be able to get all of those links and don't need to try to grab things at the exact moment. Qianqi Huang has asked if we have information, in Asian languages. And yes, unfortunately, we have limited numbers, but we do have some things that are in Chinese, and we have our healthy activities booklet in Tagalog for kids. We are always interested in expanding and making our free campaigns available in other languages. So because I speak Spanish and have lived in Central America, that one's easier, and we have a lot of Spanish speakers in our network. We have fewer Chinese speakers that have had the time to donate, but we would love that. Also, Chad has noted that the United Way has the 211 system where people can search for resources. Maps are really wonderful. So those are a really nice way, but 211 is specific to localities. So many questions. There's one I definitely wanted to get to, and that is for Lesley. Can you talk about how, and there are some in the chat box or in the Q&A box as well. So if our panelists can type in answers as we go along or elect to answer some of those live, that would be great as well. But Lesley, you have created this whole new system, this whole new platform online. And during the pandemic, that is one of the ways that people have been connecting. Diane, it sounds like that nonprofit central place at that old schoolhouse or the old school grounds is also another way to try to bring people together. But it's a very difficult, thing for social support when to have a place either virtually or physically. So can you talk about how to try to, where can you find that kind of social support that is a lot less tangible?
Go off mute here. Yeah, I think that's a great question. I think it's multifaceted. I don't think there's just one answer on how to meet the challenges for people that are needing the support. I know for the MBC community, for us that are in treatment all the time, to go to another place, to go back to the treatment center or to go back to the hospitals where we spend so much time already is one of the challenges that we face, because it's just like, oh my goodness, just one more day out, or, having to get there, and how long does it take to get there? And so the virtual setting has played a huge part in the metastatic breast cancer community. But then we're talking also about what about those that don't have the internet connections or just don't have the resources? And I don't know if there's one simple answer. And this is just my opinion. I feel like since I have been living with metastatic disease for going on 9 years, is that I've read a whole bunch of research. I've watched all these surveys being put out, and we have all these answers. And now it's time for us to put feet to what we have found out. And I think what SGV has done is amazing. And I think by us partnering, not thinking, within our own little nonprofits that we are running, but seeing us as this collaborative, this big, huge community, to be able to resource each other and to be able to, give to another nonprofit, and then they give back, trying to meet the greater needs for whether it's a virtual community, whether it's a local community. I know, I'll give you an example. So in our wellness house, in the garden, we do these nature classes, and not everybody has access to green spaces. We know that. Not everyone, has access. When you say nature, people automatically think, oh my goodness, I've got to be a hiker, or I've got to, live close to the mountains. But we teach people how to bring nature to them. So it can be, buying a plant for your house. It can be turning on some nature sounds. It can be learning some mindfulness things. So there are different ways that we can reach out to our community and make it more relatable for them, where they can, meet that need for themselves, and them not thinking that they're lacking something. Canada is doing an amazing job right now with these green prescriptions, and they are using their medical people to write green prescriptions to have people get out into nature. And so then they're partnering with their local parks and gardens, and they're giving cancer patients discounts in order to get their green prescriptions filled, by giving them, dollars off to get into gardens. And I think it's collaborations like that are going to make the biggest push forward and the biggest changes. We need a lot of social entrepreneurs out there, like Diane is, and a lot more Dr. Lin Gomez's, who can show us what, where the needs are. And then we need those of us that can go out there and just not try to save the world, but just find one problem that maybe you can change for one person. And it can just start from an idea. Think of it like a science project. What's your hypothesis?
There, I was muted. Thank you, Lesley. There is a question in the box in the Q&A that I wonder if you could also speak to, Lesley, and that is about, is the house concept just for the Native population there? Is it done for everyone in the MBC community?
Yeah, so our virtual wellness house is for everybody globally. So we had someone that became a member from Ethiopia just the other day. And we've had people from Spain and different countries in Africa. And so our virtual wellness house is specifically for those that live with metastatic breast cancer and their loved ones. What we're doing with the Native American community was driven out of me writing a grant for the state of Oregon, in being able to reach out for the diverse Native American population in the Pacific Northwest, to be able to help them to get resources such as what the virtual wellness house will offer. And how are we going to do that? I don't know that answer yet, but we're willing to work to find out.
Thank you. And Diane, do you have any advice for people who are trying to get initiatives like yours, create a group or get some activity toward having healthier options for transport and for local physical activity um, in outside of San Gabriel Valley?
Yeah, I think one of the biggest things that you can do is just ask, right? Ask around, ask neighbors, talk to people. I can give you an example. I joined the organization as a volunteer mostly because I was living in San Diego and I was finishing up my master's degree, but I knew that I wanted to get involved with the community in which I had grown up. And so I started Googling organizations that do environmental health or public health work. I found it and then I just started asking around, right? I sent an email. It took almost like 4 months to get a response because they were so swamped. And you keep asking, you keep pushing, you keep showing up. So one of the easiest ways that I could recommend is to ask around, ask people if they know if they have resources, how could they get involved? Once you've actually found a group, or once maybe you figured out that there isn't a group, um, folks say, well, just start something. And it's very difficult to do so when you have other things going on in your life, right? Especially when you're dealing with any type of health concern. Um, but something I want to bring it back to is about policy, right? And politicians. And that is one of the things that most communities, most cities have a mayor, have council members, either have an assembly member, a person in the Senate. We have access to all of their phone numbers and they are serving us, right? So the majority of us voted them in and we need to keep them accountable every step of the way, right? Just because they do great within the education realm and they do very poorly within environmental justice does not mean that we're going to let them get away with that. We put them into that office and they need to serve us well in every single type of realm of our life. They are making choices that affect us deeply, right? Such as housing next to the freeway, such as not creating or creating a bike lane, creating or not creating a bus or bus routes, getting involved and asking where's the phone number so I can either place a complaint, I could ask, I have a request on how this can improve. And sometimes we become that squeaky wheel and we have to become that in order to make those changes. So I highly recommend asking around the people that you already know, making a quick Google search, seeing if there's anything that you can become involved with or make a difference in, and then bugging your politicians because we place them in office and they need to serve us well.
That's excellent advice, Diane. And also, one of the things that came up when we were looking at different ways that people might be able to make an impact is, talking to their elected officials outside of meetings, but also, going to the meetings of the PTA, of Parks and Department. Right now in my community, they are reconfiguring the streets, and we're going to have bike lanes on this relatively busy street, which it's been very difficult before. People were riding their bikes on the sidewalks. And so we're very excited. It's been a long process and they've asked for community engagement along the way. So, we have attended meetings and answered surveys but it's important to actually, if there isn't something already going on, to take that first step to, like you're saying, start doing the Google searches or talking to people and just networking and finding out who else is interested in this, wants to work on this, and bring your efforts together. We can't do it alone. That is definitely a big part of it. There's a question in the Q&A about policy and systems change. And Catalina, I'm so glad you're with us. The specifics that you're asking about are on environmental sources of things like pollutions and the air quality and drinking water. We are specifically going to be addressing that in our fall webinar. So I don't necessarily want to get into that now, but are there any thoughts that any of you have about how to make policy change, or how, what we might be able to do in that realm.
Yeah, this is Scarlett. I'd like to address that, perhaps not specific to the environmental pollutant data, but also to speak to follow up on Diane's great point about advocating with elected officials. Is that one of the things that we heard loud and clear from stakeholders as we were developing the mapping tool, Californiahealthmaps.org, was to make the cancer and the sociodemographic data available at an area level that's specific to legislative and other political districts. And so that's what we did. And you know, one can go in there and download the fact sheets. So it provides a sort of report card, if you will, that you can bring, people can bring to and use as a way to advocate for their communities, because this is what the data are showing. And I'm hoping that people are aware of the availability to map and pull up data at those kinds of geographic levels. And I hope that people are able to find that useful for advocacy.
I have to say, it really is an amazing resource. And I'm sorry, I was going to just try to answer Chad's question about other resources like that around. There is a website, I think it's called Creative Commons, but I could be getting that confused with Creative Commons that makes things freely available on without a trademark. But there is a website that has really wonderful maps and data that have been created by states and local governments, by universities, by individual community groups, and they share those so that others will have access to that information. And I will make sure that we find that and add it into the resources that we post with the slides and the recording for the webinar. We are at time, so actually a couple of minutes over. Thank you so much for sticking with us, and really want to thank our wonderful speakers. It was so very informative, and I just always wish we had more time. But thank you, and we look forward to folks in the audience joining us again. Take care.